Hi, thank you for coming. My name is Jessie, and I'm the SSCY Center Research Coordinator and the organizer of these Represent SSCY sessions. So today we are very happy to have our lead Waldron and Pam Becker here from Jordan's Principal to tell us all about what's happening at RCC within the scope of Jordan's Principal. I think it's a lot. And then there'll be time for questions at the end. So for everyone who's joined on the webinar, if you have any questions or comments for the presenter, just type it into the chat box and I'll read it out to the presenters at the end. And then everyone in the room can just ask questions. All right, take it away. Thank you.
Thank you very much, Jessie. As Jessie said, my name is Marlene Waldron. I'm the Director of Outreach Therapies here at the Rehab Centre for Children. And we're going to tell you about Jordan's Principal and how RCC came to be involved and what our involvement is with Jordan's Principal. So we are going to start today by really saying that we want to acknowledge that we are on Treaty 1 territory, and it is the land on which we gather is the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, Dene people, and the homeland of Métis Nation. Okay, so our topics that we're going to cover today are who was Jordan? Why is there a Jordan's Principal Child First Initiative? What is the Jordan's Principal Initiative? How is it being implemented in Manitoba? What is the RCC involvement? Who else is delivering services? And then we'll have a time for questions. So who was Jordan? Well, Jordan River Anderson was a member of the Norway House Cree Nation who was born in 1999 with multiple disabilities. He was born in St. Boniface Hospital, and he needed to be in hospital in reserve life for his medical needs. He did transfer over to Children's Hospital to the probably the PICU, I'm not sure exactly, and he spent quite a bit of time there. He had a lot of therapy resources delivered to him, and he began to thrive, and he grew, and his family had the desire to bring him home. He had many needs for equipment and supplies in order for him to go home. He wasn't completely without all his needs. He was still a complex child. And in that desire to go home, it was evident that there was a lot of jurisdictional issues that were coming to the forefront that were preventing him from going home. So there was funding issues between the federal government and the provincial government, and lots of battling back and forth as to who would pay for what and how it would happen. And 2 years passed, actually, and he never did get to go home. Jordan died at the age of 5 before he could experience living his family home or a family home. And any child who was living off reserve in Manitoba under similar circumstances would have received all the supports that they required in order to go home and have the worship of family. So that was how Jordan's the issue that brought Jordan's Principal to the forefront. So in response to this tragedy, the Jordan's Principal was created. In December 2007, a motion, it was actually a private member's bill, was brought forward to the federal government, and it was unanimously supported in the House of Commons that this Jordan's Principal bill. And sadly, the implementation of the bill by the government was extremely limited in scope between 2007 and 2016. So that was 9 years, and thus the federal government and the provincial governments interpreting that kept it as a very tight scope. It was for medically complex children, and it was very tight parameters. And I know as a center, we back in 2007 looked at various case scenarios that we knew about children with particular needs who were First Nations children, and they had a rubric to get children into this formula that they had developed, and we found that we could actually never get children to the starting point through this system that had been set up in 2007. And so in August 2014, the First Nations Caring Society and Amnesty International filed fact notes or fact sheets with the Canadian Human Rights Tribunal, stating that the federal government's interpretation of Jordan's principle was narrow, restrictive, ambiguous, unlawful, and discriminatory, causing denial and delay in service for children in need. So they, the Child Caring Society, that's Cindy Blackstock's organization, and you may have heard her on various radio programs or so on. She speaks widely about Jordan's principle and the rights and needs of First Nations children. She is particularly interested in children in care as well. And so she was like a one-woman force really going forward and pushing this issue towards the Human Rights Tribunal. So they further stated that Jordan's principle must be interpreted as Parliament intended to ensure First Nations children who primarily live on reserve have access to public services on the same terms as all other children. Okay. So in a landmark ruling in January 26, 2016, the Canadian Human Rights Tribunal ordered the federal government to immediately stop applying a limited and definition, take measures to implement the full meaning and scope of the principle. So you can find the Human Rights Tribunal ruling on the First Nations Child Caring website, and I printed it there for you. We also have some information cards that you can have at the end of the presentation that has their website on it and is more information about the children's principle. So this is part of Cindy Blackstock's campaign. So Spirit Bear is the little white bear on the right-hand side. Left-hand side. And so Spirit Bear goes everywhere with Cindy Blackstock. He's been to the Human Rights Tribunal, he's been to Parliament, and he's on the cover of their calendar. So they developed Bear Witness Day, and it was the day to recognize, I guess, the 2007 Jordan's Principle bill and the waiting for the implementation to the fullest extent. And so Bear Witness Day last year was the 10th anniversary. So coming up on Thursday is Bear Witness Day, the 11th anniversary. And movement is happening, obviously. So there's new energy in Jordan's Principle, and there's celebrations around Bear Witness Day to celebrate the achievements that have happened already. And so actually Rehab Centre for Children on Bear Witness Day, we're going to have a table at the front and offer some of those informational cards, and for children who come, we're going to provide them with a little bear as well. So you can watch for that. All right, so in July 2016, there's a CBC News announcement that the federal government had announced $382 million in new funding to implement Jordan's Principle. This was the rule adopted by the House of Commons in 2007, ensuring equal access to health care and social services for First Nations children, which had been essentially unfunded to that point, so it was a principle without funding. So July 2016, the announcement was made at Norway House Cremation by the Minister of Health, Carolyn Bennett. And it was very appropriate that the announcement should be made at Norway House because that's where Jordan was from. The funding is, was announced as a 3-year block of funding, so it will end March 31st, 2019. And the $382 million was for all of the needs across Canada, and was for the 3 years. So that is the amount of money that has been set aside, and is the money that is being utilized right now for implementing Jordan's Principle across the country. So how is it being implemented in Manitoba? Well, the Manitoba region of Indigenous Services Canada, First Nations Inuit Health Branch, the NIB, took a unique approach from the rest of the country, the rest of the provinces. So in 2013, both Health Canada and INAC, Indigenous and Unrelated Affairs Canada, in Manitoba, started gathering data to find out how many children living on First Nations communities met the narrow definition of Jordan's Principle. So children with complex needs, children with needs for equipment, for housing, all kinds of things. And they had identified 500 children in their data gathering. And when the government of Canada asked the provinces about their needs, Manitoba had an answer. Other provinces told the government that they didn't have any needs, that the children were being cared for, and so on. So Manitoba got in on the ground floor quite quickly and were allocated funding. So what the Health Canada, the folks did is they asked each community. Sorry, I skipped too quickly here. They worked with each of the 63 First Nations in Manitoba and asked them to develop a project to address the needs of the children in their community and to present that proposal to them for funding. So every community has a different set of needs and came up with a different idea about how they would like to address those needs. So each community received funding for a case manager, for child development and respite workers. And then what they did with those was their programming elements. So each community has the case managers, a case manager, and the role of that person is to use a holistic model of care for the child and family, to work with the families to identify the needs of the children, and to provide ongoing coordination of care, and to work with local and specialized service providers. They have a big job in the community. They're receiving questions from their community members all the time, looking for ways that they can support them, and then to manage child development and respite schedules, to liaise with all of the specialized service providers that are involved. So programs look different in each community. Like I said, they were given the opportunity to put their own flavor on it. And many communities have day programs for children from birth to school entry. They have respite services, so some of them are group respite type of activities, maybe involving some recreational things for kids, and then also individual respite for families. Recreational activities, there are some groups do like summer camping with their families, different things like that. Taking kids on trips out of the community to experience other activities. And then there's child development, one-on-one in the home or at their site. And some of them are using their child development support services in the school if there's high needs in the schools and maybe not sufficient educational assistance support to keep the child in school. Gosh, I had a thought over my head, but oh, yes. So because space is such a big problem in many First Nations communities, there's a wide difference in what kind of buildings and facilities that Jordan's Principle programs are operating out of. So some of them have very lovely spaces that were able to be identified and outfitted specifically for the program. Some of them are sharing space with the health center, some of them are sharing space in the school, some of them are operating out of a hallway, and most of their work is happening in the community, family homes, Head Start programs, maybe daycare. So it's a wide range of situations that our staff run across when they go into the communities. So how did RCC get involved? RCC does have a long history of providing services to children and families in rural Manitoba, going way back to 1987, when RCC developed a mobile therapy team at the request of Family Services, which later became Provincial Outreach Therapy for Children, and then with the addition of the Children's Therapy Initiative. So it's kind of been an evolution of services over time, but RCC has been involved right from the beginning. And so we do have staff who actually reside in rural areas, and we have staff who travel to rural areas. So within that work, we were well aware of gaps in the system for our First Nations children. We would receive referrals for children living in First Nations communities, but with the funding arrangements with the provincial government, we were not allowed to go visit on the First Nation community. We were allowed to invite First Nations families to visit us in the local community close by. And sometimes this works, but most times it doesn't work because transportation is a big problem. Families have more than one child, so they have childcare issues when they're going to plan to leave the community with one child. Who's going to look after all of the other children? And so it was very spotty, the type of service that the children received. Many children from First Nations communities would come down to Rehab Centre for Children for specialized clinic appointments, for mechanical design services, for wheelchairs and so on. And the therapists working with them would provide that equipment, and they would try their best to offer some therapy suggestions at the same time. But again, that's just a little bit hit and miss. So with 2 children in mind, in the summer of 2016, we initially approached Family Services once again to ask if we could go and visit the children at their community. These were actually 2 children that Pam had on her caseload who had complex needs. They had equipment, and they had, medical situations that meant traveling was difficult for them. And every time Pam tried to see them at the nearest local community, they might get there, transportation might bring them, but they wouldn't bring their equipment. The children would be too tired when they got there that Pam couldn't actually do a proper therapy assessment or session with them, and they didn't have their equipment. So she couldn't show the family how to make the best use of that equipment. And this was very frustrating. So someone at Family Services said to us, well, you should talk to Pam Smith over at Health Canada. So we called up Pam Smith and we said, we've got these 2 kids. What can we do? Can you help us? And she said, yes, we can help you. Write up what you need for these 2 kids and send it to us in a little proposal. So we put together a proposal, so number of visits, what the cost would be, and so on, and gave it to her. And she immediately came back and said, yes, go ahead and do that. And then, it might have been the next day, they called up and they said, Emma, would you like to participate with us in bringing services to the 63 First Nations in Manitoba? Okay, so that's a pretty big ask. But we knew that it was needed. It needed to be done, and that we were probably in the best position to take on that task. So we agreed, and had several meetings. We had lots of tours with them over here. The folks at Health Canada had not known about the SSCY Centre. They didn't know it was here. They were amazed when they got here and thought that it was, for them, a perfect fit. And so we worked on a process of what it was that we would be asked to do and how we would manage that contract. So We landed on agreeing to deliver OTPT speech, later and audiology for us as well, and for preschool children living on reserve, and for the home needs of school-aged children. So again, knowing that this is a pretty big task, and we have lots of partners in our community that we work with already, we ought to ask some of our partners if they would like to take on this work as well. So Southern Health down Morden, Winkler, Portage area definitely agreed. They had already been working with the communities in their area, and they were thrilled to be able to take this on and expand those services a bit further. Society for Manitoba with Disabilities, we invited because there are partners in rural areas providing speech services, and we're not really big into speech, so they were happy to join us. Some SME speech therapists are laughing here, so yes. And then the Northern Regional Health Authority. So we partner with them up around the paw already with the Children's Therapy Initiative, and again, it was a natural fit. And working out of Thompson as well. That's a little bit of a tougher situation, but we're working on getting that going as well. So our early work involved meeting communities, staff and leadership, and anybody who's works out of the SSCY Centre knows that there are tours constantly going on with folks visiting us from all different communities, and they're ever so grateful for seeing this space, for seeing the possibilities, for knowing about the different clinics and services that are available here that their families can access. We've been making some community visits. We've been developing information materials, assisting communities with information on different equipment and materials, supplies that might be useful within their programs, and then hiring staff to service the communities once their programs were ready, and providing education to the different communities. So we initially created a little brochure to talk about what is OTPT in speech in the very simplest levels that we could to help communities and families just get a picture of what it is that would be coming to their community. This is something that we found over time that we had to simplify and make it more tangible for them to understand. So this is the brochure that we get out with, and again, the communities are very happy with it. So this is a picture of the map that's at the front here. So Health Canada provided us with this lovely map, which identifies the 63 First Nations communities in Manitoba. And we have put pins in all the communities where services are going in to date. And we have, again, as I mentioned, RCC, SMD, Southern Health, and Northern Health Region staff going into these communities. We don't necessarily have a full complement of OTPT and speech in every community, but we've got at least one or more of those going in. And in many cases, it is all three disciplines that are there. So again, as I mentioned, so Southern Health, and they are the clear pins. I'll go backwards here.
I can.
So they're the clear pins at the bottom of the map, and so they have Roseau River, Buffalo Point, Swan Lake, Long Plain, Dakota Plains, Dakota Teepee, and Sandy Bay communities. So if you're familiar with those are the ones that Southern Health is covering. The Northern Health Region is supporting 3 large independent communities in the north. So that's Nelson House, Cross Lake, and South Indian Lake. They primarily only have OT going in at this point in time. And SMD is supporting us with SLP services in many communities, and we'll be adding some more as well. Okay, So RCC is providing OT into 42 communities to date, and we have staff based in Winnipeg, Brandon, and La Croix. And RCC is providing PT services in 36 communities, with staff based in Winnipeg and Brandon. So PT for the communities around the law is being covered by a physiotherapist employed by the Northern Health Region living in the hall. RCC does have SLP either hired or contracted to provide services in 9 communities. So with our Brandon office of OT and PT staff, we have one speech therapist with that team directly hired by RCC, supporting the communities that they're all doing as a team together. And SMT has or will have SLP for 22 communities. And right now, our staffing is at 11.7 SLP, 9 the full complement is 11.7 SLP, 9.8 OT, 4.8 PT. We have 2 audiology or resources for 2 audiologists. We are still working very closely with the provincial audiology providers to determine how best to deploy the resources that we have, whether it's through audiologists or audiology assistants. The thing with audiology is that children must come or need to come to a booth to be have their assessments done, and the booths are in local provincial towns or cities, and so it would then fall to the provincial audiologist to cover those needs, and we're still not fully aware of what the impact of that need will be, whether it will be a big increase, a small increase, if there's a need to do audiology screening in community, how that will be done. So we're just having a lot of meetings right now to determine what the best approach will be. We do know, though, that children living in the Island Lakes area and on the east side of Lake Winnipeg, where there's only fly-in travel, that those children need to come to Winnipeg to get service, and we will be putting some resources into the SSCY Centre for that to happen. And some children have been coming already. Okay, so what is it that we do? So we're working closely with the case managers and child development workers, and the OTPT and speech services being provided to the communities on a regular basis. And we're doing assessments and recommendations for individual children in home, in day programs, Head Start programs, health centers. We've been doing quite a few preschool screening or wellness type of activities in the communities. They've been organizing to have families come, have therapists available to screen their kids on the different fine motor gross motor speech kind of areas and determine if the developmental path of this child is following kind of the normal stream, or if they require a referral, then a referral is made, or we may just make some generalized recommendations for development in a day program activity type of way. We've been doing home assessments for access and equipment needs, and with that, non-insured health benefits is the payer for equipment for First Nations families, children, adults, and they have a process that you go through to apply for a schedule of equipment that they fund. So that schedule of equipment is limited, and there are things that children need that doesn't exist on that schedule. And so through the Jordan's Principle, they've been able to set aside additional funding and have made a secondary process for funneling those non-fundable, non-insured health benefits pieces of equipment to Jordan's Principle, and that is being funded in that way. So children have been able to get things like overhead truck lift systems, iPads, recreational, adopted bicycles, all kinds of various car seats for kids,
Sensory toys.
feeding equipment, bibs, you name it. It's at this point in time being funded. So there is that secondary process. So we're all learning all about non-insured health benefits and making lots of phone calls, but certainly the avenue is open for more things for kids. All right, so we did a little survey or I guess it was, Pam and I put together a survey of about 7 questions, and we were looking to ask the case managers, child development workers, respite workers, what they thought about the service that we had been providing them. So we asked them to complete the survey monkey survey and return it back to us. And we asked about our teaming, our communication, both written, verbal, how respectful it was. We asked if the service was helpful, if it had a positive effect on their personal learning, their abilities to work with the kids, to have a positive effect on the children. And we sent that out. We got 49 responses back, which we thought was pretty good. And through all of our questions, we ended up having 93 to 100% satisfaction, or being satisfied or very satisfied, or agreed or strongly agreed with all of the questions we asked them. And then we gave them an opportunity to leave comments. And so within those comments, I just chose kind of the salient words that kept coming up and threw it into a word cloud. And so what you see on the screen there is the kinds of words that were in the comments expressing what they felt about our service. So they were, by and large, very positive words. And then this was our final question. Overall, how satisfied have you been with the service that we have provided? And 97% of our respondents were satisfied or very satisfied with our work to date. Okay, and I'm going to turn this to Pam to talk about education, and this is an area that she's been working with the communities on.
Switch with you. Hopefully with that. Yes. Don't trip ourselves.
Okay, so we've been working on setting up education we were contacted just over a year ago, a little bit more than a year ago, for education for the staff that were being hired in the communities. And so we were looking at setting up education. So I went around within RCC and within SSCY to look at what was available here and what we could create and set up for education for the case managers, for the child development workers and respite workers. And they had very differing levels of education themselves. Sorry, okay. So we worked with them to set up education, and we initially set up workshops almost exactly a year ago to date, 2 days of workshops in Winnipeg. And since then have provided workshops in Winnipeg via telehealth, and also worked very closely with the Tribal Council service coordinators. There are 7 tribal councils that are associated with communities, and then there are about 11 independent communities as well. So we have worked with the Tribal Council service coordinators who are hired a little while after that. I think it was about a year after, 6 months after. And we worked with them to set up workshops in regions that they chose that were central for their communities. And we've provided to date education on safe lesson transfers. We did that in Brandon, in Winnipeg, and in Thompson. We've done fine motor development, gross motor development, speech and language development. The therapists have gone out and done lots of workshops in the communities about how and when to refer children for therapy. We did a workshop on how to set up a respite program, and we've done workshops on the impact of the overuse of technology on child development. And later today, I will be doing a workshop on the importance of early intervention. And on Monday, we'll be going to Fisher River and doing a workshop on tantrums and behavior. We've organized a webinar for the communities. The presenter was from the Attach organization, and she did a one-day webinar on attachment and trauma. So we decided that it would be most helpful for the communities to have a list of some of the education we could provide. So we created a forum that they could look at. We looked at our resources within RCC and SSCY for what types of workshops we could provide, and put together a list of the education that we could offer. Since having sent this out, we've gotten it back with everything checked off, and they want the workshops right away in their communities. So we're working on how do we provide this to them. Being that there aren't that many of us that can go out and do the workshops, but we're working really closely with the therapists that already go to the communities, and that's been really helpful because they can provide some of the training and workshops to the community staff. So the other thing that we've been working on with the education is really looking at developing the curriculum for the staff. Very early on, one of the communities approached me and said, how do we get a certificate? How do we get certified as something similar to a rehab assistant or a rehab aide? And so that question has come up repeatedly, and so we have been working most recently with St. Amant and MATC, who both have education coordinator positions, not yet filled, as far as I've heard. But they are working on hiring education coordinators, but we are already working on setting up a curriculum and developing that. In the meantime, FNAB at Health Canada, they have organized monthly telehealth sessions that the community staff can sign into for 1 hour, and they've allocated 1 month to each specialized service provider. So MATC has a month, St. Amant has a month, RCC has a month, and May is actually RCC's month. So I'm presenting later today, and then SMD, SLPs are going to present in 2 weeks about language development. So that is another option for community staff. And we are really working with the service coordinators and the case managers to try and meet the needs in the communities. So if we hear that they need education around something, we're trying to create that workshop for them. We're also working on education for our therapists that we've hired. So we've done some cultural safety training for them, and we are working on continuing to do that. We are doing continuing education for our staff. We've organized a social thinking workshop for the middle of June, and we've also organized Kim Barbell to come in October in 2018 to do workshops for the therapists, and then also a half-day workshop for the community staff. And she'll be speaking about something related to attachment, trauma, and sensory processing. We've also set up a regular staff meetings, but at the end of this month, we've set up a gathering for our therapists to get together with the other frontline clinicians for MATC, St. Amant, Frontier, MFNERC, Manitoba First Nations Educational Resource Centre, and who did I miss? I know I missed somebody. SMD, and the Deaf of Hard of Hearing consultant from there. So it's just an opportunity for us to get to know each other and help support the case managers in the communities, hear more about what their services are happening and share. And I'm gonna let Marlene talk on clinics.
Okay, so in this last year of the funding, we put in a proposal for additional resources, and we're funded to do some outreach clinic type work. And so Child Development Clinic and the SSCY Centre are expanding their rural and urban outreach developmental assessment services to include reserved communities. And so the proposal is to use an integrated hub model where clinics will run at a central site and to service several surrounding communities. So we're looking at Opaskwayak Cremation, which is up by the Paw, and there are several communities close by. The Island Lakes, St. Teresa Point, Saginaw, Garden Hill, and Red Sucker Lake would come to one location. The Percy E. Moore Hospital, which is in Hodgson, which is a federally run hospital up around Pigwas, and so the communities in that area would be serviced there. And then Norway Hills Cremation, which is a very large community, and Cross Lake is within driving distance of Norway House. Developmental assessments for preschool age children for CDC would be what would take place. FASD clinic, they can see children up to age 21, I think, Mary and I are right. I think for Jordan's principal, the age range is 0 to 21, so I'll defer to Mary on that one. And then they're planning to complete 2 trips of 3 days duration to each of the hub communities. And by taking, I think it is 2 physicians, it would allow for 48 assessments per year per hub. And then there's additional psychology that would augment the assessments, and telehealth consultation and education could be offered as determined by the need of the community. And then we also have a proposal for a feeding clinic and mechanical design and services to do some outreach. And again, using a hub model to take those services out to the Island Lakes, to Thompson, and to the Norway House area. So feeding clinic would include pediatrician specializing in feeding, a feeding clinic OT, the RN, and the dietitian, and the focus would be for the children with gastric tubes, with neurodevelopmental conditions such as autism or CP. They would not be looking at children with picky eating as an issue. And then MDNS is an important service to bring forward because it's very difficult to haul all that equipment long distances for review and repair. So it would be an opportunity for some of those pieces of equipment to be reviewed, for kids to be measured for new equipment without having to travel so far away from home. All right, so who else is delivering services? So you've heard us mention these names before. Health Canada has called this group of service providers the specialized service providers. So we are one of those, and St. Mont is a specialized service provider. They have services including psychology for managing challenging behavior. They have nursing services for seizure management and tube feed training, dietitian services for picky eaters, family support, social work. So for families living with a child with a complex situation, it doesn't have to be physical, it could be behavioral or developmental kind of issues, and the family is struggling with that, they will go in and support the family on how to manage. They have counseling services for individuals and families, and they also provide education, as Pam had mentioned. So you can contact St. Mont. They have an email address and a phone number that you can contact them if you want to ask more questions about their services. So SMD has been brought on board again in this last year through the Communication Centre for Children with a teacher of the deaf. and once again, focusing on the needs of preschool children. And so they'll deliver intervention services for preschool kids diagnosed with a permanent hearing loss. And so they can do direct service, consultation, workshops, and telehealth. And there are the phone and email contact information. They did send out a big informational package to all of the communities, so communities are becoming aware of that service being available as well. MATC, so their Rural Northern Telehealth Service. This is an extension of an existing program that was developed to address issues of suicide originally, but it is, and that was for, I think it was 10 communities that they were in, so they now have this available to all communities. They offer counseling for a range of mental health concerns, and they have psychiatry services available if it comes that a diagnosis may be required or medication management is needed. So children who have sort of missed the CDC opportunity for diagnosis of autism, those kinds of things, this service can pick up that little bit for the older children. And they still continue to do a lot of their work through telehealth, and they will tell you that the youth today are very comfortable with doing that work across the telehealth. In fact, they probably prefer it in many ways because it can be done very quietly within the community. Nobody has to see them going with a strange person who came in who's like, oh, that's a lady for mental health, that kind of thing. So the youth are actually quite satisfied with that telehealth approach. Manitoba First Nations Education Resource Centre, they're an organization that falls under the Assembly of Chiefs and is they support all the band-run schools. There are 49 communities and 50-some schools, 53 schools. They have a full range of educational support specialists, reading clinicians, educational psychology, mental health, or counseling type roles, Indigenous language, sign language, teacher of the deaf, URIS nursing, and then they also have OT, PT, speech, and audiology that were added through the Jordan's Principle. They have 8 OT positions, 2 PT, 9 SLP, and 2 audiology, and they've also received a little bit of increase for this coming year. Frontier School Division. So Frontier is in 15-ish communities. Frontier School Division has on-reserve and off-reserve schools, so they're an organization that does things differently because of that. But they have their own SLP services, and for many years, RCC has been a contract service to Frontier School Division for many of their schools, not all of them. So that has continued. They have received funding for 7 mental wellness positions for their schools through the Jordan's Principle. And I guess an interesting fact is that they actually bought a therapy dog as part of their complement of services, and that has been going very well for them as well. Eagle Urban Transition Centre is also a piece of the Assembly of Chiefs, and their mandate is to advocate for children and adults with special needs, disabilities, and or mental health issues on and off reserve. They are based in Winnipeg. At this point in time, they are expanding to Brandon, Dauphin, Thompson, and the Paw, I believe. And they provide assistance and support in obtaining long-term respite for people living off reserve, and will provide short-term respite, off-reserve respite. So families who are in transition on off reserve, if they have to come off reserve because of medical situations, Eagle Urban will be able to support them in the time that they're waiting to get onto the provincial services. Otherwise, children living off reserve are just accessing existing provincial services where they are. So they offer advocacy support, and they'll find services, make referrals, find supports for families. So they're a good ear for family to go and talk to if a family is struggling in the system that they're faced with. And there's a phone number here as well. And so this is the Government of Canada website, Jordan's Principle. There's a ton of information there. So I would encourage you to go and have a look. And then you can see the key contact people from Manitoba. So Joe Gashru and Lynn and Joe Herb for FINIB, and then Mary Brown and Benny and Scott for the former INAC side, Indigenous Services Canada. They're the people that, Mary Brown, they're the funders for the education system. So health and education are split along those lines, and they do all the housing pieces as well. So any home assessments, recommendations for home modifications go through the Mary Brown side. Here we are, and time for questions. Yes, Mary.
I might be helpful to clarify just a couple of points around the CCFA.
Do you want to come up and speak so that it's recorded through the microphone?
Just quickly to clarify the scope of the project with Child Development Clinic and the FASD Centre. So there was 4 hub communities that were identified on the slide. One of those hubs will have FASD assessment services only. So that's the Norway House area. And currently we just have the capacity to see youth up to the age of 17. So we know the RCC, as part of RCC, the service extends, but we don't have the assessment team to be able to go beyond that in Norway House. And then the 3 other hub communities, the focus there for this year will be for the preschool population for child development clinics. So there is a little bit of lots of questions around that, but I can take any other questions, but that's the scope.
Thank you, Mary. Thanks.
I think we are experiencing a significant amount of confusion around children who are previously on reserve are now in the city. And so what and the different stations that we've been to have given different information. So our understanding is that when a child is finally relocated to Winnipeg, that they are entitled to the student supported by all of the provincial programs that are available to them. But that's not necessarily the understanding of the parent or whichever advocate happens to be with them. What they're looking for is all the services that any child living in the city would have, plus then the layering of Jordan's principal funding or that would come with them from reserve. And then everyone gets stuck there, and we're just not sure who to take that up with, who actually says yes or no. And it's happening more and more. So where will we take that?
So the question is about provincial services and children coming off reserve to the city and still having the expectation that they get the provincial services plus Jordan's principal supports. And so she's asking where do they go to get an answer for that question, because there's confusion. And I would say go to Joe Gasharoon and ask that question. Yes, I experience that all the time too with families living on reserve expecting Jordan's principal support. So I tell them when we're contracted to provide services on reserve, and that provincial services are what's available. But yes, it is definitely a challenge, absolutely. And the access to equipment for people with treaty status is still available, even though they're off reserve. So that creates a bit of a challenge as well. You're welcome.
What happens after March 9th?
So the question is, what happens after March 2019? So yes, the funding is supposedly ending at that point in time. All of the talk that we're hearing from our Health Canada folks is that the funding will continue, they just don't know in what form it will take. So, yeah, it would be kind of political suicide for a government to pull back on a program that's that well established. So we're hopeful that it will continue.
So how do we access services for a family we see in Winnipeg that's now going back to?
Oh, okay, so the question is, how do you access services for a family who's in Winnipeg but you know is moving back to the community? I would suggest that they be asked to contact the case manager in their community to discuss their needs.
So is there a list of that?
There is a list, yes. So we have provided that list out to various people, but if you require that list, please just contact me and I'll get that to you.
More questions from the audience?
Okay.
How do you expect that the move to shared health would affect services overall?
I don't, so the question is about how will shared health affect the services. So I don't know a lot about shared health and what their mandates are, but I can't really answer that question yet.
Thank you so much for leaving time to come. There's a lot of information. I know it's really important for everyone to be learning about this. So, and also thank you to everyone for coming. And another special thank you to Barb and Kelly for all of their help with organizing and setting up every month, especially Kelly today, some technical difficulties. So, and if you want to watch the recording of the webinar, I will post it within this week onto the RTC and SSCY website, so you can view it yourselves and you can send it to anyone who you know who might be interested in watching it. And if anyone has any further questions for Marlene or Pam, you can either let them know or email me and I'll send them to them. So next month is our last session of the season before summer break, and we'll be hearing about education programs from the Movement Center, one of our SSCY Network partners. So thank you again for coming, and if you haven't signed in, if you could sign in before you go, just so we know how many people are coming and where everyone is coming from. Thank you very much.
And please help yourself to a card here as well.